So this is part 3 of my series of interviews with Dr. Ricardo Mejia of Jupiter, Florida. While my interviews are taking place while Ricardo is serving as president of the ISHRS, they might be released after his term ends in just a few weeks. In part 1, we talked about the ISHRS and Ricardo's presidency. In part 2, we discussed the consultation and ethics. In part 3, we'll discuss the number one thing patients want to know about hair loss and hair transplantation, which is, will my hair look natural and grow back permanently? Hi, I'm Dr. Robert Haber, hair loss expert and hair transplant surgeon from Cleveland, Ohio. Join me and the Hair Transplant Road Show as I travel the globe seeking answers to important surgical and non-surgical hair loss questions from the true experts in the field. Please support this program by selecting like, subscribe, and requesting notifications when our next episode is available. Ricardo, you are so correct. I am asked this every single day. And of course, there's good reason, right? In the early years of hair transplantation, though the plug years, and even decades after the disappearance of that technique, patients remain wary of looking peculiar after surgery. Plus, today with the black market world of hair transplantation, we see horrible hairlines. How do you address that question from your patients?
Well, obviously, I say, yes, it's going to look natural, but part of what looks natural, you have to get into the patient's mind and head and so forth, because what some people might think is natural to them is not natural. Okay, and so number one is explaining exactly what you discuss, because sometimes people come in and it's like, what kind of plugs are you going to use? And I was like, well, number one, we don't use plugs. That is an expression that was years ago. That was the typical toothbrush, doll's hair look. And it used to be groups of multiple individual follicles planted at one. Now we take individual hair follicles of 1, 2s, and 3s, we call follicular units, and transplant them in an aesthetic manner where we have singles in the hairline followed by 2s and 3s and 4s and so forth. Okay, so the hairline is designed to be, very natural, that it looks like normal so that somebody would look at it and not even know it was a hair transplant. That's what a good aesthetic hairline is supposed to be. It is supposed to look natural and is designed in the way to reproduce what you had originally and not reproduce something that does not exist typically in nature, which is what we see a lot in the black market, hairlines that don't normally exist in nature.
Yeah, and there's two different questions which we'll address. One is the natural, because the natural look depends on the artistry of the surgeon. How long the hairs will last is more complicated. We'll get to that in a few minutes. But there are, what is a natural hairline, right? There's ethnic differences. There are personal preferences. Not every hairline has to be the same. And of course, a receded, balding look is a natural hairline, right? Because nature gave that to you.
Yes.
But what we want to do is bring it back to something that isn't like you said, a straight line. The eye doesn't like straight lines and perfect lines. And what astounds me is surgeons, hair transplant surgeons that have been in the field for a long time that still create unnatural hairlines. I never look at anyone without paying attention to their hairline because there's so many different kinds of hairlines. Every time I do a skin exam and I'm examining the face, I'm looking at the hairline. I'm saying, oh, well, that's different. That's natural. Because all you have to do is replace or replicate something that nature has done, and it's natural. You follow some very simple principles, and you create hairlines that are beautiful. And they shouldn't obviously all look exactly the same because that can't be your stamp. Oh, that's a Dr. Haber or Dr. Mejia hairline. The hairline has to fit the head, right?
Exactly. And some of the things when you talk about hairlines, it has two meanings really. One is, in one fixed point, how the hairs are put in that area right here, which is, the single hairs, groups of single hairs followed by 2s and 3s in an irregular fashion. So it's not a straight line in one specific area. And then there's a hairline that goes all the way across the head, as you were talking about. But that hairline, what you might want to call it the global hairline, is going to change depending on the patient's face characteristics, their culture. Do they have a short face, a wide face, a long face? So it's going to change significantly. And what is their heritage too? And I'll give you a perfect example. I had a patient that came in and I drew a hairline on him, and what I thought was actually a nice hairline. And the one thing he says, like, oh, no, 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 I want to keep my high, temporal angle here, And I was like, really? He said, yes, that's kind of a tradition in our family. Everybody in our family has that, so I don't want to lose that. I just want to fill in the front here. I was like, oh, okay. And that's part of getting back to what we talked about earlier, the consultation, is that his hairline was completely different than another individual that might want to blunt some of that area. Okay. So that's why I call it, the global hairline, which kind of encompasses the whole global image of the face and rounding out the face, or bringing it low, framing the face. And in this case, that patient wanted to keep his high temporal angle. So that's what's important about um, hairlines is a consultation, because you just can't create the same hairline on everybody, because like you said, and I have seen patients before where doctors near my area, I can tell, yeah, I know who did your procedure because it all looks the same.
And of course, they sell templates, the plastic
Yeah.
things, and you'd use a template. It's not going to work. I mean, when I design the hairline, I have a way that I always start everybody from the center, whether it's 7 or 8 or what centimeters, and I'll sketch the hairline in. And then I step back and take a look.
Mhm.
Maybe once a month, I nail it the first try. Every other patient, it needs a lot of modification. The left there's bumps in the forehead, there's misshapen heads, there's squashed heads.
Exactly.
And so you have to design and customize that hairline to fit not just the patient, but the shape of the head. And then, yes, the expectations. Much easier to have a patient like you had that wants it higher than to have a patient say, well, doc, can't you bring it way down here like this, like I had it
Yeah.
when I was 12 years old? And that's a much longer conversation at that point to explain why that's not going to look good.
Yeah.
Not just short term, but it's certainly not going to look good long term.
Yeah. And, and that's kind of when sometimes you have to say no, because, you know, um, of course, when a patient asks, will I have a natural looking hairline? You have to make sure that they understand what that means globally and, individually, but also what their expectation is. Because, I did have this one patient that was older and he had like a class 6 balding. And part of sometimes what I do is I let patients kind of describe to me what their expectation is, and I give them a little green pen and I say, draw a hairline for me and tell me what you think you're looking for. And they drew something ridiculously low across their forehead and said, and I want it from front to back covered completely. And that's where I kind of realized, no, this is not really a patient that has a right expectation for hair surgery. I actually referred him for a hair system, because he could get as much density as he wanted and he can get it as low as he wants. But from a hair transplant standpoint, I tried to explain something more reasonable, something more conservative that would frame his face, look natural, but he didn't seem to want that, and we didn't agree, so we did say no to him.
Yeah.
But the hairlines is unique; it's different, and that is the question that you have to basically tell patients and explain and have a proper education. And sometimes that proper education is showing before and after photos of how hairlines are designed, how they look before and how they look after, because pictures do speak 1,000 words. Now,
And that's so important. We talked about the consultation earlier. That's something that's got to be covered in the consultation. And it's frustrating when I spend time in the consultation and then the morning of surgery, it's like the patient forgot all that and say, no, but I want it here and I want it here and I want it here. It's like, if they want all that, I sometimes say, no, I can't do that for you. I'm not gonna my signature, my hairline, that's my signature. I don't want you to go to somebody else and have say, oh, Dr. Haber did that.
yeah,
Not going to happen. So
yeah,
I'd rather say no and let somebody else do that than to be pushed. There's a wiggle room. I've pushed things a little bit based on patients' expectations and been happy with that. But
yeah.
there's a line that I won't cross when I know, what, that's got my signature on it, and no, thank you.
And there have been instances, and this is part of being an ethical surgeon and just, being a responsible surgeon. If you do have those situations where you're kind of negotiating with the patient, so listen, I think this would work, this is going to be good. And, patient's like, okay, fine, go ahead and do it. Sometimes I'll take a picture of it, I'll print it, and I say, so this is the hairline we agreed upon. And I have him sign it just so he's acknowledged that, we've agreed on this more conservative hairline so that there's never an issue later saying, well, doc, you didn't really do what I wanted, this, that, or the other thing. And so
Right.
that is part of a proper informed consent is that you have that communication with the patient of what you're really going to do, and what you're not going to do.
And unfortunately, we can never satisfy every patient. No matter
That's true.
what we do, there's some, you know, body dysmorphic or hard to satisfy patients that slip through the cracks, and they're exhausting. They're exhausting.
Hmm. Hmm.
It drives me crazy when someone posts on Reddit or another forum their hairline after a black market procedure, most commonly now Turkey, but certainly elsewhere because there are excellent surgeons in Turkey. The hairline is straight, low on their forehead, and they ask, how does this look? And invariably somebody responds, great hairline, dude, you must be thrilled. And other
Yeah.
people pipe up. And this gives other potential patients a terrible idea of what aesthetic surgical results should look like. And like, there is no way that that patient is going to be happy with that hairline. It looks horrible. Getting our message out to people is so challenging to make sure they understand, what good hairlines and what ethical and conscientious and skilled surgeons will create.
Yeah, and it's unfortunate because I think that sometimes there's this concept of you know, well, you've bought something, so now you have to be happy with it, and then I think people just end up kind of accepting the fact, and they're kind of a little bit too embarrassed sometimes to say that they're not happy with it. And I've seen patients that have gone to some of these black market clinics and had hairlines too low, and I said, well, do you want me to remove those grafts because they're way too low? And they're like, no, 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 I kind of like it there, and I'm like, really? And I was like, okay, I wasn't going to force him to do something else, but it was definitely way too low. It was like in the muscles, which we know you're not supposed to transplant into the muscles. But somehow this patient, I think, psychologically just convinced himself that he was okay with it, and we didn't end up doing anything with it.
Yeah. At our annual World Congress, we regularly spend time teaching proper hairline design, and yet so many surgeons do a poor job with this. And this is why I emphasize that choosing a surgeon who has reached fellow status in the ISHRS and who's certified by the ABHRS dramatically increases, doesn't guarantee, but increases the likelihood that that surgeon has mastered the critical aspects of surgery and will end up creating a natural, good looking hairline. So
Well,
important.
yeah, I'd like to correct you on one thing, potentially, Bob. You're using the word surgeon who's created your hairline. And that may not necessarily be the case. It may not be a doctor who's designing your hairline.
Well, yeah, but hopefully, if they're a fellow of the
Oh,
ISHRS
yeah,
and
yeah, yeah, yeah.
certified to be ABHRS, they've got the
Right.
ethics that they're designing the hairline and not delegating that to
Yeah, yeah.
somebody else, which should not be done. That's such a It's not surgery, but it's a critically important step in the surgical process. If you don't get the hairline right, nothing else matters.
And I guess that kind of leads us back to the initial question. Doctor, will my hairline look normal and natural? And it all goes back to it depends on who's designing your hairline. Is it a doctor? Is it a real doctor? Is it a doctor that has experience with hair, that keeps up with hair, that belongs to a reputable society, that's going to meetings and constantly improving? Or is it a doctor that's delegating the procedure to somebody else and letting somebody else do the surgery?
Right, right. I mean, and that's the black market. The black market is right here in Ohio, in centers where plastic surgeons buy a machine and then delegate it to a group of traveling techs. Those are almost always disasters because the doctor has delegated this critical step with that they should be doing themselves. Yeah.
Correct.
Regarding how long hairs will last, when a patient asks me, Doc, will the transplanted hairs last forever?
Yeah.
I answer, they'll last as long as they would have lasted if we'd left them back where they were, because all of our organs and structures eventually fail, and that includes our hair. And in some really elderly men, the hair at the back of the head just a wispy remnant of its former glory, and any hairs harvested from the back of such a head will be slowly lost as well. A much bigger issue is FUE also, where grafts are routinely harvested well above and well below the traditional safe zone. And I believe that future hair loss in extensively harvested patients will result in both the loss of those hairs as well as potentially visible scars. What's your thoughts on that?
Well, I agree 100%. And that's I almost answered the same exact way. When people ask me, is like, is my hair transplant permanent? My standard answer is your hair transplant will be as permanent as your donor hair. And I give them the example. I was like, listen, if I had my assistant here, Angelica or whoever it is, count all the hairs on the back of your head. Let's just say they spent hours and hours and counted 10,000 hairs. Okay. And we transplanted those hairs and moved them to the front. Okay. And then you come back when you're 90 years of age. Okay. How many are going to be left there? Well, if you didn't have a hair transplant, and you came back and I counted the same number of hairs, and now I only count 8,000 hairs as opposed to 10,000, it means you lost 20%. So you have the chance of also losing 20% of the hairs in the front because of the same genetic loss over time. So that's usually how I answer my question, which is similar to what you said.
Yeah, and I think we've been in the field long enough that I've seen patients once in a while that come in that I operated on 20 years ago, and it's so gratifying to see those hairs are still there. And
Yeah.
on some of them, there's thinning, but again, the same kind of thing. They're just thinning diffusely, and we educate them about that. But
And
young surgeons don't have the 20-year perspective. You got to wait 20 years to see your work come back, but it's very gratifying to know that, yeah, those hairs are there.
yeah, and you can, and like you said before, we're going higher and higher. We have an extended donor zone now for FUE, and there are some patients you can predict that they may drop their donor area back here significantly, and if expanded at an early age, okay, yeah, over time those hairs might also recede. So it's just something that has to go into part of the standard consultation with each patient.
I agree. It
Excellent.
gets back to the ethics as well
Yes, exactly.
as
That's why I
I
said
offer
ethical.
I offer strip and FUE and what I tell my FUE patients is because if they're a head shaver, to me the two absolute reasons for FUE are if they're a head shaver, then even one of my beautiful linear scars is going to be visible, and if the scalp is very tight and I can't harvest a wide strip, then they have to have FUE. Those are two absolute indications for FUE. But if
Absolutely.
it's a relatively young person and those are their features, then I always tell them I have to harvest above and possibly below the safe zone. And over time, you might lose those hairs and have visible scars. We're going to try to keep that from happening with medications, but it's a potential. So I warn the patients. If they say, I understand the risk, thank you for telling me, I still want to proceed because right now in my next 10 or 20 years, I want to have those hairs, then we proceed. What bothers me is doctors that don't give them that fair warning, harvest way above and below, but don't tell them those could be temporary hairs. That
Exactly.
I don't think is ethical.
Yes. Yeah. And I think it's fine to say, listen, those hairs might be temporary. We don't know when they might fall out. They could hang in there till you're 50 if you're 30 now or 60. It just all depends on what your genetics are. Now,
Yeah, go ahead.
I would say, and I have some patients like this. We have patients. Sometimes I ask them, "What's your family history?" Talk about their family history. It's like, listen, if your hair loss is exactly like your dad's and exactly like your grandpa's, and you follow a same trajectory path, and your dad doesn't have any hair in the back now, and he's completely bald, well, then there's a high chance you're going to follow that same pattern, and you just have to be aware of that. And if we harvest from that area up there over time, when you get to be your dad's age or so forth, just realize that you're gonna end up the same. And whatever we harvest from way up here is gonna be lost because people do shrink their donor zones significantly over time as well.
We both know that. We both have seen that endlessly. I see all the patients come in and they have their safe zone still there, but boy, if they'd come in at 25 or 30 and had extensive FUE, 80% of those grafts wouldn't be existing anymore. That's
Yeah,
a
and I
big
and
concern.
I, and I've taken some pictures of somewhere it's just a thin, wispy donor area in the back and like no hair at all. And I was like,
Right, right.
it always reminds me of this exact scenario. It's like, wow, if he would have done FUE years ago, he'd have nothing on top.
One of my favorite quotes was from Dow, one of the very first meetings that we had, and he showed a photograph of the back of the head of a man with practically nothing in the back of the head. And he said, "What do we call this man?" And there was silence in the room. And he said, "We call this man lucky. We call this man lucky that 30 years ago he didn't have surgery
Yeah.
because he would have wasted his money. He'd look a mess right now. He looks fine as a bald man. he's lucky that he didn't do anything that he would now regret.
Yeah.
And it's always, it's been something I've remembered, and I share that.
Yeah, and I will tell you one more thing about this because I think it is important. It's not just, when you're going from 30 to 90 years old. I mean, sometimes it's from 40 to 50 years old. Okay, because even I myself have done hair transplants on, 40-year-old, man, and wonderful result, wonderful result. But had side effects to medications, didn't want to take pills and so forth, and so just relied on surgery alone and no other treatment options. Well, from 40 to 50, they did lose a lot of significant hair, okay? Natural hair, not only in their donor area, but also up top. So guess what? Their hair transplant didn't look as good as it did, 2, 3 years right after surgery because they continue to recede and lose hair significantly without proper medical therapy or without any of the regenerative treatment options that are now available. And, when you look at the hair transplant, even I myself say, wow, it didn't look as good as it did 2, 3 years ago. Why? Because of their continued genetic hair loss that rapidly progressed over a 10-year period.
Thankfully, most of those patients still say, I still look better than I would have looked.
Well, that's true,
I
and I do
still
tell them,
like the hair that I have in my head.
I do remind them if you didn't have all those hairs that you now have, that still
It'd be
gives you some
nothing.
coverage, you'd be
Right.
completely bald.
Yeah.
And they're like, yeah, I'm happy for those.
Okay. Well, this has been a great topic, probably the most important question for a patient to ask. And it brings to an end part 3. I hope our viewers find my conversations with Ricardo informative and helpful as they navigate the hair transplant journey. Ricardo, you have been a great president and a
Thank
great
you.
guest. I'm very pleased you were able to finally find an opening in your busy schedule to chat with me. Ricardo, I'll see you in a few weeks in Berlin, and I'll see our viewers next time on the Hair Transplant Road Show.
Done.
Thank you, Ricardo Mejia.
Thank you.